In addition to knowing how to do CPR, it is also important to know how to care for a choking baby and how to remove a foreign object airway obstruction. However, you should not confuse a foreign object airway obstruction with airway swelling resulting from an infection such as a cold or bronchitis. In this case, there may be a barking cough, and you should transport the baby immediately to the nearest hospital for treatment. Choking or foreign object airway obstructions can be caused by foods such as hot dogs and peanuts and hard candies, or small toys such as beads and marbles. To prevent injury, you should never practice actual airway obstruction rescue maneuvers on another person. This is why we are only simulating them here or using a mannequin. A baby's airway can either be partially or completely obstructed by a foreign object. When the airway is only partially obstructed, the baby can cough strongly and make wheezing sounds between coughs. At this point, do not interfere. Forceful coughing may be enough to expel the foreign object. If the baby cannot expel the foreign object, poor airflow may develop quickly. Signs of poor airflow are a weaker cough, gagging, high-pitched noises while inhaling, noisy breathing, and bluing of the fingernail beds, the lips, and the skin. These signs should be treated as a complete airway obstruction. When the airway is completely obstructed, the baby will not be able to breathe or cough, and you must immediately act to relieve the obstruction. Position the baby face down with one leg on each side of your arm, with your arm resting on your thigh, and with the palm of your hand holding the baby's jaw. Keep the baby's head lower than the body. Next, with the heel of your other hand, forcefully deliver back blows between the shoulder blades. Then position the baby between your hands. Turn the baby onto the back, keeping the baby's head lower than the body. Now with your fingers, give chest thrusts at the same location as chest compressions in CPR, but at a slower rate. Continue the sequence of back blows alternating with chest thrusts until the foreign object is expelled. If the baby is too large or too heavy to be held on your arm, the same maneuver can be done with the rescuer sitting and the baby lying across the rescuer's lap. If you are unable to relieve the obstruction and the baby becomes unconscious, call out for help. If someone else arrives on the scene, quickly send that person to call for emergency medical help. Obtaining emergency medical help is of the utmost importance. For an unconscious baby, you must check for a foreign object airway obstruction using the tongue-jaw lift maneuver. To do this, position the baby face up, then grasp both the tongue and the lower jaw between your thumb and finger and lift upward. Look into the baby's mouth and remove any foreign object that you can see and grasp. If you cannot see the foreign object, or you are unable to remove it, then open the airway using the head tilt chin lift. Determine if the baby is breathing by listening for breathing, looking for chest movement, and feeling for exhaled air on your cheek. If the baby is breathing, continue to keep the airway open until help arrives. But if you do not hear breathing, do not feel exhaled air on your cheek, or do not see the chest rise and fall, you must keep the baby's airway open and attempt to give a rescue breath. Take a breath, open your mouth wide, seal it over the baby's mouth and nose, and give a rescue breath. If the chest does not rise, reposition the head, reopen the airway, and attempt another rescue breath. The obstructing object may still prevent your being able to give a rescue breath. When this occurs, turn the baby over. Give back blows. followed by chest thrusts. Then perform the tongue-jaw lift and look into the baby's mouth, removing any foreign object that you can see and grasp. Open the airway and attempt another rescue breath. Continue this sequence of back blows, chest thrusts, tongue-jaw lift, and rescue breath attempts until you are successful. If you are able to remove the foreign object airway obstruction, make sure to check the baby for breathing and pulse. If breathing and pulse are absent, start CPR. Even if CPR is not needed, a physician should still examine the baby immediately.